Hi.
Hi, my name is Kathy Erickson. I'm 60 years old. I had surgery in my neck last year, surgery in my lower back last year. I also had thoracic outlet surgery 10 years ago on my left side. Came to Dr. Levin. I could not walk. I had to hold onto my hip in order to walk. I literally came here from my surgeon's office. I saw the doctor the same day. The surgeon sent me here. I am now able to walk without pain. Up here in my shoulder, I had a big raised area. My family actually named it the hump, and the hump is going away. Down my arm, I had terrible pain. I would wrap my arm in warm rags from work, warm towels, and try everything. My best friend was ice. I haven't used ice in 2 weeks. I would ice this. I would sleep with ice on my hip. I've had 3 transforaminal injections in my back and 2 transforaminal injections in my neck and facet injections, and Dr. Levin injected my hip, which turned out to be bursitis, which I saw 2 hip doctors and they missed the diagnosis completely. So I also had some damage to a nerve from where they took the bone from my neck surgery, and I also had a radiculopathy involved from when I had the back surgery, and now I am like 75% better. I look better. I'm working better. When I was working a month ago, I was using one of my patients' walkers in the morning. I'm a nurse on a long-term care facility. So in the morning, I really could not walk. I was using a walker to get through the day. And now I'm like a new person. My whole family agrees with me. And coming here is, I already said it once today, not to be dramatic, but it has changed my life. It has saved my life, really. My whole family's been so concerned.
When Kathleen came to me, she was having, she was very tearful, was basically in extreme pain and had radicular signs. Also some signs looked to me like a chronic regional pain syndrome, and signs of hip pain too, which is a little bit tricky. Her joint space wasn't bad. We decided first to do transforaminals to try and cool down the radiculopathy, which we did. She still had unchanged pain at that point, just because the pain was so bad, she couldn't really tell. But her strength and sensation got better, so we used that as a marker to say that this was improving. We then looked at the site where she had the bone harvest, and I think there was a small fiber neuropathy, probably from the, some bone growing in there, possibly damage in the peri-surgical period, which we did some injections for those.
Right.
I examined her hip and noticed that she did have pain on certain weight-bearing maneuvers and subtly on certain other triggering maneuvers, so I just said clinically she had hip pain of an undiagnosed source. We were finally able to get some imaging, and that imaging actually showed a calcified bursa and tendon, which to me reminded me of a plantar fasciitis kind of a presentation. So with that, we undertook a very rigorous injection of the calcified areas, and this was very, very painful, and that helped a lot too. At the same time, we titrated methadone to a total dose of about 15 milligrams total daily, so not a very high dose. And between the procedures and this, now her activity level is much higher, and our activity tolerance is very substantially improved. I think our ongoing problems may be continued, back issues, radicular issues, regional pain issues, and hip. But I think now what we've done is isolated at least now 3 different pain generators in one patient. And the interesting thing is that the patient just noticed total pain in that body set of segments altogether. It was so bad we couldn't really determine which was causing what symptom. But as we treated, we looked for subtle signs clinically, and then we could see if the treatments were successful, and then we're able to address things separately. And using this approach, I think she did well. But we'll continue to monitor and see how she does. Okay, thank you so much, Ken.